I am Mark Marshall, and I'm one of the 3 founders of Haiti Health Initiative. Haiti Health Initiative is a non-profit organization focused on serving the public health needs of the rural villages in Haiti.
Well, we're going to Haiti as a group. Well, this will be my 4th year to Haiti. No matter what happens, every year I'm a little nervous to go, yeah.
I'm just nervous to see something that I've never seen before. I really don't know what to expect. I mean, I've only heard stories.
A lot of people didn't know about Haiti until the earthquake, or at least they didn't know how bad the situation was. Port-au-Prince is a very crowded city. We have trash everywhere. The main canalization systems were full of debris and trash. It's very sad.
I honestly didn't know what to expect. I knew it was going to be poor. I knew it was going to be bad conditions. I didn't know it was going to be this bad.
So the impact of the earthquake is huge. Took the lives of many people, 300,000 people.
Poverty in Haiti, I guess, would be a little different than we would consider poverty in this country. Most people in Haiti, particularly rural Haiti, have no access to electricity, no running water.
A lot of organizations, a lot of non-profit organizations, they focus their work in Port-au-Prince. But there's a need outside of Port-au-Prince for assistance. We went to a remote village outside of Port-au-Prince called Timo.
You travel up on the mountainside and then actually hike down into their village.
We are in the beautiful village in a deep canyon named Timo in Haiti.
Our goal overall with HHI is to improve the overall health of rural Haitians here in the mountain villages. As you can see, we're in a beautiful area.
I guess we'd look at a country who has a lot of poverty, and we're here to do, I think, a couple little things just to try to help them out.
The idea was to take the medical and dental care to them. The dental clinic, they do a lot of things, including extraction of teeth, some cleaning of teeth, some filling of teeth. And then in the medical clinic, some are sick, some have major things, and some have minor things. But we see those patients and try to give them the right prescription. Sometimes it's an antibiotic for an infection. They don't have a lot of access. As far as I know, there isn't anybody who comes and provides medical care, so they have to basically go into the city if they're going to get health care.
The closest clinic from the people would be within about an hour or an hour and a half away. So I wanted to help people in a way that is sustainable, meaning not just putting a Band-Aid on a problem and then leave.
My name's Steve Larson. I came on this trip to help them get some ideas of what they could do to develop a water system that would work.
Oh, look right here. That's probably it right there.
There's several water sources here in the village of Timo. So, the effort this particular trip is to try to identify what environmental factors are impacting their health. And so we're testing the water to see what's in the water and what's not in the water. and to try to decide whether or not water is a major factor in their health right now.
In addition to providing medical and dental care, we wanted to find out the root causes of their illnesses so that we can research culturally appropriate solutions for those problems.
I was born in Fondois, Timor. The principal activity of these communities is agriculture. 20 years ago, Fondois was covered by trees. The peasants cut almost all the trees, either the fruit trees or timbers, to make coal.
We looked at the environment and then we found out that there was a need to help reforest Timor. We found out that there was an opportunity to help the people learn about a drip system that would help them to increase their crops.
The main problem is the education.
So they've been cooking the beans already.
Freeze it.
My name is Kathleen Nielsen. I'm a dietitian. I specialize in helping people have better nutrition. And so they wanted to do more than just come every time and bring vitamins. And so they asked me to come and evaluate their diets and see what we could do to improve in that way.
So there's a number of things that we can learn that I think is going to end up changing what we do.
And so we're out here not only providing the health care that they need, but also giving them the education and knowledge to move forward.
Education is very important. Of all of the things we've done, education is probably the most important thing that we've done.
So before they leave this clinic, we don't allow anyone to leave the clinic getting a kit of any sort unless they've actually sat through an educational session. And that's because we believe that we're not here to give handouts. That doesn't really empower the people. That doesn't help them to move forward and be independent. When a baby is born, you want to get it to breathe. What can you do to help this baby breathe more easily?
Unfortunately, the people don't have a lot of the knowledge they need to improve their health. The people here crave knowledge. They absolutely crave it. They want to learn, they want to understand how to improve their lives.
I do this just because I love humankind. You know, I was raised to always help other people.
So long could I make memories. That time has come. Farewell, how it used to be. What's done is done. So long, time is here to change. It's so easy.
But the other thing that strikes you is the people, and I've always been very impressed with the Haitians as far as their resiliency and how they are able to make a living.
And I think we have a responsibility. We're not given what we have to just sit back on our tail and just enjoy it. We're given that opportunity because the majority of the world lives close to this kind of subsistence, and it's, you know, it's up to us to really reach out to them.
I don't feel like I have a lot to offer, but I do have some knowledge and experience that I think can go a long ways. And it's one of my favorite things in life is to see people take new knowledge and to apply it and be excited about it.
The vision is to support current healthy living practices in those communities where we go, and then promote culturally appropriate interventions.